The First Lady, Your Excellency Fatouba Barrow, the Governor of West Coast Region, Honorable Minister of Health, other Honorable Cabinet Ministers present, Honorable National Assembly members, the World Bank representative, and other eminent development partners, security chiefs and senior government officials, district chiefs, alkalolu, distinguished personalities, religious leaders, members of the press, ladies and gentlemen. Today is a red letter day in the healthcare delivery system of this country, as it marks the formal opening of the Gambia's first ever delegated food and drug testing laboratory. This is a landmark achievement grounded in our National Development Plan, IRWA, and guided by my government's vision of building a resilient, self-reliant, and more prosperous Gambia. Distinguished ladies and gentlemen, countries that want to maintain a healthy population must ensure that their nationals eat the right mix of food and take safe and effective medications. Going by such standards, this lab facility is sufficiently furnished with modern equipment to detect harmful elements and bacteria in foodstuff. In the same way, to safeguard public health, well-trained staff will be on hand to test and confirm that medicines used in the country are safely and effective. For ages before the acute kidney injury, AKI, disaster in 2022 until now, we rely on test certificates from India and Ghana. Sometimes we waited for weeks for results of the sample tested abroad. Of course, our citizens paid dearly for that arrangement, as delays often cost lives and substandard medicines generally have negative consequences. This laboratory now empowers us not only to test and verify food items and medicines, but also act on our own terms in accordance with acceptable standards. With these advantages, the Food Safety and Quality Authority, the Medicine Control Agency, and other in-country regulatory bodies will be able to carry out their mandates more efficiently. And ladies and gentlemen, from now on, we must remove all unsafe food items from our markets and fake medicines from our medical facilities and pharmacies. To succeed, our health personnel must increase routine surveillance of foodstuffs and intensify testing of medicine across the regions of the country. To protect and save lives, let there be no compromise on our standards and regulatory frameworks. We urge the business community to appreciate that regulations are not barriers to success, but bridges. My government will continue to work with manufacturers, importers, processors of consumer goods to help them meet the agreed standards before their commodities reach the shelf. In compliance with international standards, and to compete in ECOWAS member states and other global markets. The required food and drug testing services will be readily available and open for pre-market testing. Let me stress that the government will not tolerate substandard products. As a result, the Honorable Minister of Health and his team are tasked to secure the necessary accreditation status of the lab, register with the WHO National Control Lab Network, and train certified analysts and technicians for prompt service delivery. In addition, we must put our stamp on all tested products to make them stand out wherever they are displayed. Ladies and gentlemen, let us embrace this magnificent lab as an indication of our collective determination to ensure that every citizen and resident of the Gambia is protected from ill health and health hazards. As a government, we will continue to listen to the people and act on their needs in their best interests. This is a responsibility entrusted upon us by the people, and we will not fail them because our primary focus remains firmly cast on peace, development, and security for all. This lab is evidence of our belief that development must be people-centered. From this day on, it will serve as a tool for our scientists and a legacy for future generations, and a reassurance that whenever Gambians put their trust in us, we will deliver resoundingly. The tragic Aki incident that claimed the lives of our beloved children and shocked the nation 4 years ago exposed major weaknesses in our health system. It painfully reminded us that access to safe drug is a right and not a luxury. We have since resolved that Gambians would never again be exposed to similar tragedy. The investment in this facility is as much the outcome of that resolve as the fulfillment of our promise to the nation. We are proud that through the World Bank, the laboratory now stands as a public health pillar of resilience, hope, and safety. No longer will the Gambians rely solely on other countries to verify the safety of our medicines and food. We will test them here, certify them here, and protect the citizens and residents of the country. Ladies and gentlemen, I express deepest gratitude to the World Bank for funding this important project. Mr. Mutaha Kana, through you, the World Bank Group resident representative, we register sincere appreciation to the World Bank. I also congratulate the Ministry of Health under the able leadership of Dr. Amadou Lamin Samit on this historic development. And I thank the contractors, the supervising engineers, and all those who helped to make this day a reality. The staff of the lab now bears the heavy responsibility of discharging their duties with utmost professionalism, mindful that the integrity of the government and this institution will be measured by their performance and achievements. Let us move forward together with the consolation that from the tragic circumstances of the past has emerged this solid pillar of protection. With this remarkable sense of accomplishment, I declare the Gambia National Food and Drug Quality Control Lab facilities open.